Hello everybody, I'd like to introduce you to Maxwell. He's my buddy and he's going to be helping me today and throughout several other video series that we're going to do. This is Secret Oompa, and Maxwell and I are going to discuss DID and dissociative disorders. And the first video we're just going to talk about what are dissociative disorders, what is dissociation, symptoms, and things like that. And then as people have questions, we'll answer those questions as accurately as possible. We're trying to take down the myths that are out there of DID being crazy, or everybody always having switches and always being able to know who's DID and things like that. Point of this is to bring awareness of it, and what I'm going to tell you and what I'm going to talk about and what Maxwell is going to help me talk about today is information and facts that have come from reputable resources. For example, today most of the information that we're going to go over is coming from the Sidran Institute, and I'll link that on the site, the YouTube site. So with that, we're going to get started. Once considered rare and mysterious psychiatric curiosities, dissociative identity disorder, or otherwise known as DID, previously known as multiple personality disorder, and other dissociative disorders, are now understood to be fairly common effects of severe trauma in early childhood, most typically extreme repeated physical, sexual, and/or emotional abuse. In the Diagnostic and Statistical Manual, DSM-4, it was changed to dissociative identity disorder, reflecting changes in professional understanding of the disorder resulting from significant empirical research. Post-traumatic stress disorder, PTSD, widely accepted as a major mental illness affecting 8% of the general population in the United States, is closely related to dissociative disorders. In fact, 80 to 100% of people diagnosed with dissociative disorder also have a secondary diagnosis of PTSD. The personal and societal cost of trauma disorders is extremely high. Recent research suggests the risk of suicide attempts among people with trauma disorders may be even higher than among people who have major depression. In addition, there is evidence that people with trauma disorders have higher rates of alcoholism, chronic medical illnesses, and abusiveness in succeeding generations. Again, this coming straight off of the Sidran Institute website. What is dissociation? Dissociation is a mental process which produces a lack of connection in a person's thoughts, memories, feelings, actions, or sense of identity. During the period of time when a person is dissociating, certain information is not associated with other information as it normally would be. For example, during a traumatic experience, a person may dissociate the memory of a place and circumstances of the trauma from this ongoing memory, resulting in a temporary mental escape from the fear and pain of the trauma, and, in some cases, a memory gap surrounding the experience. Because this process can produce changes in memory, people who frequently dissociate often find their sense of personal history and identity are affected. Most clinicians believe that dissociation exists on a continuum of severity. The continuum reflects a wide range of experiences and/or symptoms. At one end are mild dissociative experiences common to most people, such as daydreaming, highway hypnosis, or getting lost in a book or movie, all of which involve losing touch with conscious awareness of one's immediate surroundings. At the other end of the extreme is complex chronic dissociation, such as in cases of dissociative disorders, which may result in serious impairment or inability to function. Some people with dissociative disorders can hold highly responsible jobs, contributing to society in a variety of professions, the arts, and public service, appearing to function normally to coworkers, neighbors, and others with whom they interact daily. There is a great deal of overlap of symptoms and experiences among the various dissociative disorders, including DID. For the sake of clarity, this will refer to dissociative disorders as a collective term. Individuals should seek help from qualified mental health providers to answer questions about his or her or their own particular circumstances and diagnosis. Okay, just a few thoughts on this. There are people out there that do hold highly responsible jobs. They contribute to society, and they function quote-unquote normally to coworkers, neighbors, and others with whom they interact daily. I have worked several jobs where I've been able to maintain and do quite a bit and have high responsibility and do that automatically. I myself have dissociative identity disorder and have been able to do that, and nobody is the wiser of switching or what may actually be happening inside. The other topic, or the other thing that I wanted to go over, is the memory. I don't want to feed into the false memory syndrome foundation. I believe that every person who is trying to recover memories, I support them in their recovered memories, and I believe that therapists shouldn't lead their clients into situations that may or may not have occurred, but rather support them in what they say. So if the client says that they have recovered a memory, listening and having an open ear is the important thing, and it's not a matter of whether or not it's true or false. I totally support anybody who comes up or who has a memory that they have recovered, and I don't think it's false. Now off my soapbox. How does a dissociative disorder develop? When faced with overwhelming traumatic situations from which there is no physical escape, a child may resort to going away in his or her head. Children typically use this ability as an extremely effective defense against acute physical and emotional pain, or anxious anticipation of that pain. By this dissociative process, thoughts, feelings, memories, and perceptions of traumatic experiences can be separated off psychologically, allowing the child to function as if the trauma had not occurred. Now, to me, that's brilliant, because now the child can go on living life as if it hadn't occurred and be able to do things that they would not normally be able to do if they were still in that trauma. So being able to dissociate the trauma actually allows children to be safe. And unfortunately these things happen, but it's something that the brain is able to develop as a coping mechanism, and I think it's a very good coping mechanism at the time when the child needs it.